Hello and welcome to today's expert series webinar on training in the pandemic. Today's our second edition of the series in which we speak to leading players in the GWO network about best practice and innovation, helping the network to take sensible steps when considering how they'll reopen after the COVID-19 lockdown. Today's guests are European Wind Academy. They're part of the Fairwind group. They provide a big suite of GWO and platform-specific training programs. And during its first 3 years, it's established as one of Poland's largest GWO training providers. It's also one of the few that remained open throughout the pandemic. So today, hopefully, we hope to learn what it took to do this successfully while keeping employees and participants safe. So a quick look at the agenda for today. After I've introduced our panelists, we'll take a short pictorial tour of European Wind Academy. This will take around 15 or 20 minutes, and then after the presentation, we'll quickly run through some of your feedback from last week's webinar and then take your question. The slides will be available. We haven't had time to upload them as a handout yet, but we'll make sure they're emailed to you and they'll be available on the website pretty soon after the event, as well as will a recording of today's webinar. In the meantime, when it comes to the Q&A, we'll ask that you unmute your microphones. You're all on mute at the moment, but so you can ask questions to myself and the panelists directly. In the meantime, please type any questions you have into the box and we'll get to them when the time comes. So introducing myself, I'm Ralph Savage. I'm Head of Communications here at GWO. I've been with the organisation for 2.5 years and I'm in charge of how we interact with our stakeholders. Our guest panelist today is Vitaly Stepinski, Academy Manager at European Wind Academy. Vitaly's been with EWA since it was formed in 2017. He's responsible for all operations and commercial activity at the centre. Prior to this, he held roles with the Royal Danish Embassy in Warsaw and at Vestas, following a career in journalism and public affairs. A man after my own heart. And from our team here, Jakob Jakobsen is CEO of GWO. He's led the Secretariat since it was formed in 2014, prior to which he held leadership positions with Wind Denmark and as a board member of Wind Europe. So a warm welcome to both of you guys.
Thank you.
Hello.
So one quick slide before we continue. We're really grateful to our training providers for the feedback they've given us during the pandemic. This week, as many of you know, we've completed a survey to understand the network's reopening plans, and we'll issue much more detail on this in the coming days. For now, though, I just wanted to share this information with you. Hopefully it's clear on the screen, but as you can see, almost 30% of training providers in our survey sample have already opened, and a little over 10% remained open during the pandemic. The remainder have provided us with an estimate of when they expect to reopen. It's important to understand there are a lot of variables in this data, including the overall sample size, the local rules governing whether a company is permitted to reopen on a certain date, and what impact local economic conditions are going to have on the viability of training people in those countries. A quick question, Jakob, if you have any thoughts on, what feedback we've got from the sample so far, and what this indicates for us over the next few months.
Yeah, okay, so first of all, a huge thank you to all of those who have helped us fill out the survey. It really gives us a good feel for what's going on there, and some good intelligence that we look forward to share with you guys. And as you said, Ralph, one of the striking things is that there is a lot of change, a lot of difference between country to country. So there are some country-specific issues, and we have to be fair in mind when you look at these numbers. It doesn't necessarily apply to your own country, but this is taking a global view. That said, I think on the global view, it is more positive than I had thought. The rate at which you reply to us coming back to business and being able to train technicians, you are slightly faster than I had hoped for, and it seems like you're also ready, as in general, to take in even more course participants compared to last year same time, because we realize, of course, there will be several hundreds, if not thousands, of technicians that have run out of their training, and as they come back, you will experience probably a hump, an increased demand in the first weeks or months after releasing the travel restrictions. And you seem to be able to cope with that. That is very, very encouraging.
Okay, thanks, Jakob. All right, so let's move on to our core topic, and a quick reminder to those of you who didn't tune in to our first edition. The purpose of this webcast is to share knowledge and best practice, but GWO and its members subscribe wholeheartedly to the advice provided by your governments and the World Health Organization. We certainly have no intention of encouraging you or your companies to begin working prematurely or to contravene the advice given by your own authorities. So I hope that's extra clear. So introducing European Wind Academy. Vitaly, perhaps you'd like to give us a brief introduction to EWA. The business was established 3 years ago, has grown really quickly.
Correct, and first of all, welcome to everybody here, and thank you, GWO, for continuous support during the pandemic. We have been using your coronavirus notes, advisory notes, since they came up the first time, so that's very much appreciated. In regards to our profile, we were established, as you mentioned, 3 years ago with the clear intention to support our mother organization as a first step, meaning Fairwind, with their installation and service job that they do across the world, pretty much. The first intention was to focus on GWO basic safety training courses, and we did so in 2018. But of course, we also have delivered some other OEM-specific training in the meantime. That this is something that we do, I would say, as a second step of our activity. Given the size of our mother organization, we are very lucky with the amount of the customers we can host in our training center. As you said, we are growing quite fast, and we expect this growth to continue the next couple of years.
Thanks, Vitaly. And moving on to the local circumstances in Poland, I think of particular interest, aside from the bullets that we put on the screen, is the fact that you and many other GWO training providers in your country chose to remain open. How did you reach that decision?
You know, our first, the patient zero in Poland was diagnosed in March 4th, and actually we, by March 6th, have incorporated some of the internal procedures back then already. We observed the situation in Poland, but also in Europe and broader, very closely, looking at what are the advisory coming from WHO, coming from you guys, and as I already mentioned, and how can we prepare ourselves. So we, of course, started with some internal procedures, looking what can we do to improve the security during the courses. And when I think it was March 11th, the Prime Minister from Poland declared that from starting mid-March, we will close the schools, the daycare, and organizations as such. My first reaction was that we need to introduce the training freeze in our organization. We will finish up what we have started. We will focus on improving the procedures that we have and make sure what we can do better or smarter. And that was something that I have communicated to my mother organization. But in the meantime, I have also talked to our project managers out there in the fields, needed support, and our techs needed the proper education. And we have, after long discussions and many challenging days and hours, we have decided to stay open because we need to support our customers, we need to support our mother organization, but at the same time, we have to maintain operational during those weeks and months of crisis, because we thought, and I think the history proofs are correct, that this will stay with us for longer. COVID is not something that will vanish within 2 or 3 weeks or even months. We'll have to learn how to live and operate in those days. And at the same time, not only the medical status is our biggest concern, but also the economical status of our trainers, of our staff, or on over 1,000 of Fairwind technicians out there, and the organization itself.
Yeah, thanks, Vitold. I think when we go through a sort of pictorial tour of the training facility, a lot of the adaptations that have been made are those that you put in place immediately after making that decision anyway. So let's move on to that part of the presentation.
Sure.
So as we can see, you've got a large facility in the picture on the right-hand side. Here's some illustrations of the activities you put in place when people enter the building. Temperature checks being the activity that's being carried out there. So just tell us about these activities and why you implemented them, and what steps you've taken beyond.
So of course, we are lucky to have as you mentioned, large facility, because we have just relocated November last year. So we have plenty of space that we could use in order to introduce procedures that help us maintain the situation. Initially, what you are seeing here on the right-hand side is, of course, something that we have introduced as of May 4th. This side entrance, as so to say. Before that, we have used the main entrance to the building to let the people in. We have asked them always to be in the facility prior to the training, 15-20 minutes prior to the training, so we can run the procedure of checking the temperature, of course, disinfection of the hands. We have asked them to fill in the forms in the beginning if they were traveling. Then when the borders were closed, that was adjusted accordingly. We asked them if they have any contact with people possibly sick or haven't been under quarantine. And of course, the temperature check, something that we have done. From the start, we have also offered them rubber gloves, and later on also introduced the face masks. This is not something that we have to do by law, but we consider this as something that we should introduce just in case they wanted to feel more safe. Social distancing, obvious thing. We have very early in the March introduced that we are changing our operations and allowed maximum 4 people in the classroom. Then we have changed that May 4th, and now we are allowing max 6 people in the classroom.
I think that helps us move on to the next point, where you've got an illustration from the classroom environment. Where so this is taken after you increase the class size numbers, right?
Yeah, this one on the left, it's just 4 people, because in the smaller classroom we have actually 1 smaller, and we allowed only 4. Mm-hmm. In the one on the right side, it's a relatively large classroom, so that's the 6. It's the max. As you can see, there is a distance, and they are not wearing masks. According to Polish legislation, if you can secure either the distance of approximately 1.5 meters from potentially sick person, you can just sit without the masks. Mm-hmm. We give them the opportunity, we give them the mask if they don't have them, but when they enter into the canteen or the corridor, they are obliged to wear masks. And of course, we encourage them to disinfect their hands quite often. Outside, we have 3 disinfection units. So they are also instructed by our trainees as a first of the slides before the training of what should we do. Of course, cover your mouth when you sneeze and keep the distance, wear the mask in the common areas, disinfect the hands, and remember about the hygiene, things like that.
Okay, thanks. So before any training can begin, there's always going to be an enhanced sanitization process. We learned a lot about how that was done in Kaohsiung University in Taiwan. Here we've also included an image from a first aid module, as the two connect in a specific way. It's the disinfection of both PPE and equipment that's going to be used by multiple people. Can you give us a bit more detail on how you manage your sanitization?
It's of course learning by doing. Unlike our colleagues from Taiwan, we are only 3 people in the administration, and looking at the numbers that we train, it's really hard work to control everything only by us 3. So we very much count on our trainers to do the job as well. And we started the disinfection mid-March to make that the facility and the main parts of the facility were disinfected on a daily basis. They still are, of course, plus the equipment after each use. We disinfect them with the alcohol-based liquid, but we also allowed people to use rubber gloves underneath the working gloves. We disinfect the first aid and working at heights dummies. We encounter people to use their own PPE for working at heights, and this is quite often the thing, because when you are talking about GWO basic safety training, normally we have those trainees coming mainly from Fairwind, and those are new guys when they are picking up their new equipment just from the warehouse around the corner. So it's brand new, sealed. So we are quite confident that that this is something that is under control. And maybe I forgot to mention one of the first steps that we have also introduced when we are thinking about downsizing the classrooms. We also choose with whom we want to work with, if I can say it that way. We simply remain open for, of course, our mother organization with restrictions, and also with the customers that we were confident that they are providing us with the sufficient information. So when we ask if there was a person traveling in those heavy hit by COVID countries, or they have been seeing any symptoms of illness, that they will report or cancel the training.
Yeah, that's been a theme that has come back from a lot of the feedback that we've received from training providers about knowing more about their customers, and perhaps sometimes if they take groups of employees from one business at a time, as opposed to merging groups from different employers, just to reduce.
Yes.
Yeah.
Yes, it's a trust issue that we could see from the start, and that's paying off. We can see that we have a positive feedback coming from our customers, that if we ask them to distribute the surveys among their technicians, and to ask them to observe their health condition, they do that and they report back. So this is very much appreciated also.
Great, thanks, Vitaly. Moving on, it's good that we've got your case study today, because EWA trains a good number of VTT courses, and that's not something we've gone into in any great detail in these webinars, at least. So what unique steps are required to maintain this type of training in a safe way?
First of all, we already touched upon that, and you can see it on the picture over there. It's the distance. We are lucky enough to have that space available, and we can pretty much group people of 6 and keep the distance at the same time. They normally, when we ask them when they are in the classroom and the distance is there, we keep them to remain in the distance, but they are not obliged to wear the masks. But when they enter into common areas like canteens or warehouse, we ask them to use the face masks, and if they want, also the rubber gloves. So they have that minimum isolation from the dangerous situation. We also use the disinfection units. There is one in the entrance to the warehouse standing there. So, and I could see people are on my cameras. I can see that people are actually using that quite often, and this is something that we are growing as a next habit. We have disinfection fluids in every room you can manage to have, and the outcome also of this situation and training technical courses is that we have to equip ourselves with more technical equipment, because normally when you have I don't know, BTT installation, you work in groups of 2. Here we focus on this to maintain the small groups 4 and then 6 people, that we have enough equipment so they can work individual. if the support from the trainer or other trainees required or necessary, then we offer people masks, gloves, and also face shields to reduce the risk of getting too much of a closure to the other person.
Yeah, so it's worth bearing in mind that for groups where even working in pairs is the norm, there could be a additional amount or additional requirement on you to provide more equipment so that people can work separately and individually.
Yes, and I think it's not only reflecting the training, the technical training, because we also observe that in the basic safety training modules that we need to gear up ourselves and buy some more equipment, which is not an easy decision to make when you are in the crisis mode, and the investment is put on a hold, or you prioritize that as something that you will do in 2 or 3 months from now.
Yeah.
But you have to buy some more equipment in order to maintain operational in the safe way.
Yeah. Let's move on to one of the BST modules. Working at height, as we learned last week, it's one of the modules where adaptations can be made. There have been some advisory notes from GWO. And again, we've got a really good idea of the size of the room that you're working in, so distancing can be maintained. The actual lesson elements have been adapted as well, so you can explain a little bit about that.
Yes, so first of all, again, it's about the distancing. When you see the structure on the left side, we have a group of 6 people which is divided into 2. And according to the refresher of the Working at Height standard, you can change the ratio to 1 to 6, and we choose, not because of COVID, but we choose that early in 2020 to maintain the 1 to 4, because we consider this to be much more effective during the training. So you can see, despite the fact that we have 6 people, we have 2 groups, 2 instructors. They all use the PPE, which is disinfected, of course, but then they also use face masks, rubber gloves, the distance in between, and 2 other things, the security glasses, and we use training dummies.
Mm-hmm.
And training dummies, that was something that we never get too much of. We are actually waiting for some more to come. We are working with different models, and because of the crisis, some of the manufacturers in Great Britain where we are purchasing this were closed. They reopened recently, but we are still awaiting for some new products. So we had to adapt. So we reached out to our first aid instructors and our fire awareness instructors if they have mannequins or dummies that we can possibly use for our training, and they helped us out. You can see the one on the left side, the blue one. It's actually rented out from Working at Heights department from fire department in Szczecin that is working with us.
Yeah, so
you have to gear up for that. That's for sure.
Yeah, and I can imagine it's having to deliver according to a safe way of working, and then the challenges of finding the right equipment is probably quite common for all of our attendees and other training providers who want to reopen. So let's keep that part of the conversation going. Yeah. Okay. So we're through with the pictorial tour of the Academy, and moving on just a little bit, we wanted to give you some feedback from last week's edition, and this is obviously relevant in general, but please keep sending us your feedback. It really, really helps. So just some comments that came in from last week. Renewables Academy in Ireland provided us with a list of adaptations they've made, including staggering starts, breaks and lunch to minimize contacts in communal areas. They've also implemented storage of PPE and PFPE in Ziploc plastic bags to avoid possible cross-contamination. Another set of feedback we got was from FMTC in Holland. They reopened on Monday this week, and society there is slowly beginning to open up. They remind us, and this is a really common theme, is that international travel remains a big challenge. So in the beginning, they're going to anticipate small groups of local delegates. And they emphasize some adaptations they've made to the registration process, which reflect a lot of what you've been talking about, Vitold, including a corona symptom self-declaration. They do that on a daily basis. They add that most of their customers were expecting temperature checks, but unfortunately Dutch legislation, privacy legislation, doesn't allow this. So they've provided an opt-in option, so there are thermometers around that people can use if they want to kind of self-certify. So that's good feedback, and please, keep that coming in. Jakob, I haven't asked you a question for a little while. They sound like sensible steps and show again the need first to look at the country's local legislation, and if appropriate, go beyond if that's beneficial.
Yeah, it sounds all of it sounds very very appropriate. I have a couple of questions to you, Vitold. Like a general question, what do you think are the greatest challenges in all of this? And I have a specific challenge that I would like you to address. It's really around the face masks, where you lose a lot of communication when you have to wear face masks, especially if the instructor wears a face mask. How do you overcome that kind of a challenge? Challenges and the one specifically for face masks.
Okay, so maybe I will start with the face mask because that's actually something that I've been wondering myself about. We have implemented this as of May 4th, when it was implemented also by the Polish government to have an obligation. And we tried with different masks, with the surgery mask, which are not too much of a protection against the virus, but it gives you a confidentially some sort of a better feel that this is everything under control and secured and people are isolated better. We started then with the we started with the filter masks, but it was impossible to communicate anything to anyone. So we changed into lighter masks, social distancing, and face shields. So it's really up to the people that we are working with, because some of the trainers, they prefer to use face shields and masks. Some only face shields. Some do it without the mask. They maintain the 3-4 meters distance from the nearest person. So it's not easy at all, and you have to take more breaks, and you have smaller groups. So normally you go faster with the program, so you are allowed to make more breaks into the training. It's not easy. I cannot give you a clear answer of which is the best solution, because it depends from person to person.
Yeah.
And when it comes to the regards to what are the biggest problems we had in the beginning, was actually I was the one trying to get disinfection gel, liquids, face masks, nitrile gloves, and other essential equipment on the market, which was crazy problematic. It's maybe not anymore that much, but the prices rose 4 times in Poland for rubber gloves. The disinfection liquids, I was calling our supplier every day, trying to push them to provide us with some more. Luckily, we had some stock, so right now we are okay. But in the beginning of the coronavirus pandemic and the announcement from the Polish government, it was a panic mode. So it was really a challenge to get those basic equipment for the training center. And of course, last but not least, you have to understand that the people are only people, and that they fear participating in the training for 3-5 days in the training center with other people around. So you have to work on your communication, and you have to make sure that your procedures are strong enough.
A question from me, actually, Vitold, about accommodation and keeping people fed and watered while you train them. It is a concern amongst other training providers, is whether they open or not, will there be anywhere for people to stay? I noticed in the one of the opening slides that we had about that, shopping malls and hotels were reopened in Poland. But has that been a challenge for you during the pandemic?
It was a challenge because the hotels were closed in Poland for quite some time. And as you mentioned in the beginning, we had steps, and we still have, of defrosting the Polish economy. And step 2 finally allowed, that was 4th of May, finally allowed to open the hotels. Before that, you could also use the hotels if we're traveling for business. So if there was a official delegation, or however you call that, you could actually use the hotel. Not every single hotel in the near proximity was open, but we could manage this as well.